July, which we're only a few days away from, is known as Fibroid Awareness Month. And it kind of aims to bring awareness to one of the most common gynecological conditions nationwide. We have got Dr. Edward Heitman from Secours standing by to kind of tell us more and tell us about some new treatment options that is really going to be helpful for women. Thanks for being here with us.
Well, thank you for having me on.
Okay, I hear a lot of people talking about fibroids, and I've had people say like, oh gosh, I may have to have surgery because mine are so bad. What exactly is the fibroid?
So fibroids are benign tumors or growths, if you will, that come from the muscle tissue in the uterus.
Okay.
The uterus primarily has two tissues, a thin lining on the inside and then primarily muscle throughout the rest of the body of the uterus. So fibroids are benign tumors that grow from the muscle tissues. They can be small, size of a grape, up to cantaloupe size or even larger.
Wow. And I guess when they're larger, that's when they cause problems, or can the small ones be problematic too?
Certainly. Depending on where they're located, any size fibroid could be a problem. If you had a very small one inside the lining of the uterus, it could cause menstrual abnormalities, bleeding problems, cramps, and certainly the larger they get, the worse the symptoms can be.
Is there anything we can do to prevent, even getting them, or is it just something like, hey, yay, you're a woman, it's going to happen?
Well, that's a good point. Unfortunately, we don't really know what causes fibroids, and most women get fibroids at some point during their reproductive lifetime. As much as 3 out of 4 women, or maybe even more, will get fibroids. They're not always symptomatic, but frequently they are.
When would you know, this may be something I need to talk with someone and maybe start doing something about?
So anytime there might be a change in the menstrual cycle, whether it's heavier flow or more irregular flow or more cramps or pain or other sort of symptoms, maybe sometimes trouble getting pregnant, it certainly is a great idea to follow up with our physician and start the dialogue to figure out what's going on.
All right, and then it comes to the treatment options. What are some of the treatment options available?
So a lot of times we can start off with medication depending on what's going on, what sort of symptoms. Something as simple as a birth control pill. We fortunately have new medications now that can help control bleeding problems. We can use simple medications like ibuprofen to help with cramps. When medications don't work, or sometimes if they're in a location that may not be amenable to medication therapy, we might discuss surgical procedures.
Okay.
In the past, a lot of times that meant things like a hysterectomy or something.
Oh, wow, yeah.
Yeah, or something called a myomectomy, where you go in and cut the fibroids out individually. Nowadays, there are some cutting-edge technologies that we offer at Secours St. Francis that involve very minimally invasive techniques, where we can go in and use high radio frequency ablation, which creates heat to kill the fibroid tissue, kills the nerve endings and blood supply, and it is very quick to recover from, sometimes just a couple of days.
I mean, that is a lot better, because anytime you think surgery, I mean, that's usually like at least a week. I mean, right?
Certainly.
Yeah.
With the two approaches with the radio frequency ablation, or RFA, if we go in laparoscopically, most women can recover in 2 or 3 days. We can also go up vaginally, transcervically, to treat the fibroids without any incisions, and most of those women can recover in a day or 2.
In a day or 2. That is crazy. And this was like, some of this new stuff was just like released yesterday?
Well, not quite, but certainly it's been very investigational for a few years. Until the last couple of years. We started offering these procedures at St. Francis a couple of years ago, and just started offering the transvaginal, transcervical approach just a few months ago.
See, this is why we love Secours. They've always got, the newest and greatest. And listen, if someone is having symptoms and wants to get them checked out, or even if someone who just wants to, kind of start regular checkup, what's the best way to make an appointment with one of the OBGYNs there?
Well, we have several practices that are affiliated with Secours St. Francis. The best place to start, of course, would be on the website, bonsecours.com.
Love it. You make it easy. All the information right there. If you need to, talk more or just make an appointment, go online. Check them out. They're a great health system. We love that y'all are such great partners of the show. Thank you so much, Dr. Heitman. We appreciate it.